So today we're going to talk about ankle arthritis. Hi, it's Jeff McAlister from Arcadia Orthopedics and Sports Medicine, and today we have another patient coming in with ankle arthritis. Ankle arthritis is debilitating. Typically, it's post-traumatic ankle arthritis. And what I want to teach you today is what ankle arthritis looks like. We're here looking at a CT scan. We've already reviewed the x-rays with the patient, and this here is ankle arthritis. What we can see here is bone-on-bone arthritis here. And on the side view, we can also see bone-on-bone arthritis here. So this would be a normal appearing joint, and this is what bone-on-bone arthritis looks like. So let me differentiate and teach you one thing. Today we're going to discuss ankle arthritis and levels of deformity, okay? So when a patient has bad ankle arthritis, it can either turn in or turn out, and we call that valgus or varus. So when an ankle is in valgus, basically the two segments separate and touch on one side and do not touch on another side. So it's incongruent. Does that make sense? So what you can see here in this depiction is what this would look like in a model form, and that's basically what that would look like. Can you see that? So when we have a patient with ankle arthritis, we have to talk about options. What we talked about today was an ankle replacement or ankle arthroplasty. I'll show you what that looks like. So now we're going to deal with an ankle replacement. Again, we've already discussed with the patient what ankle arthritis is, the expectations, conservative treatment. We've exhausted all of that. And so now we're going to talk about some options other than an ankle fusion. An ankle fusion can be debilitating. It was the gold standard and has become a second option for patients because the technology has improved. So there's really two different types of ankle replacements. There's about 10 on the market as of later this year. But what we're going to talk about is a semi-constrained or two-piece component versus a mobile-bearing component. And this has three pieces. So first we'll talk about the semi-constrained total ankle, and that's what this looks like. And what that means is the poly or plastic piece is hooked to the tibia or top piece. This is a great ankle option for this ankle arthritis and this patient with bad ankle arthritis in an incongruent manner. So that means that you're not going to have a lot of play in the ankle, and therefore it would last a long time in this patient. Usually I say about 10 to 15 years later, you're going to need probably a gutter debridement or scar tissue cleanup and a poly exchange or the plastic liner. This is a mobile bearing device. You can see the plastic piece in the middle is a little unsettled when the patient's foot goes into valgus or leans in. This ankle doesn't tolerate this deformity very well. It can in the right patient, but the patient has to be non-obese, perfectly healthy, and limited activity. So this ankle implant is mobile. You can see the plastic liner pops in and out. And it's very easy to replace, and in most ankles that are parallel or congruent, it's a great option. But for patients like this, we're really going to lean towards a semi-constrained total ankle. Check back with us later for an update.